Question 1. The control framework reveals that following a minor oral surgical procedure, a patient is being discharged. Which of the following constitutes the most comprehensive and ethically sound approach to postoperative care and patient management? Option A. Prescribe a broad-spectrum antibiotic and recommend over-the-counter pain relievers, with instructions to return if the surgical site appears infected. Option B. Offer detailed written and verbal instructions covering wound care, pain management, dietary recommendations, activity restrictions, and clear contact information for urgent concerns or follow-up. Option C. Provide the patient with a prescription for pain medication and instruct them to call the office if they experience any significant issues. Option D. Advise the patient to rest, avoid strenuous activity, and generally monitor their healing, with a follow-up appointment scheduled in 2 weeks. The correct answer is C. Provide the patient with a prescription for pain medication and instruct them to call the office if they experience any significant issues. Explanation. The control framework reveals that managing postoperative care for oral medicine patients, particularly after surgical procedures like biopsies or minor excisions, presents a multifaceted challenge. The primary difficulty lies in balancing immediate patient comfort and pain management with the prevention of complications such as infection, bleeding, and impaired healing, all while adhering to established clinical guidelines and patient safety protocols. This requires a proactive and individualized approach, anticipating potential issues and equipping the patient with clear, actionable instructions. The correct approach represents best professional practice because it prioritizes comprehensive patient education and readily accessible support. This aligns with the ethical obligation to ensure informed consent and patient autonomy, empowering individuals to actively participate in their recovery. Providing detailed written and verbal instructions, along with clear avenues for urgent communication, directly addresses the potential for postoperative complications and ensures timely intervention if issues arise. This proactive strategy minimizes patient anxiety and promotes optimal healing outcomes, reflecting a commitment to patient-centered care as mandated by professional standards and ethical guidelines governing oral medicine practice. An incorrect approach that focuses solely on pain medication without addressing wound care or warning signs fails to meet the standard of care. This oversight can lead to delayed recognition of infection or bleeding, potentially causing significant morbidity and requiring more complex interventions. Ethically, this constitutes a failure to adequately inform and protect the patient. Another incorrect approach that provides vague postoperative instructions, such as rest and call if problems arise, is insufficient. This lack of specificity leaves the patient ill-equipped to identify concerning symptoms, increasing the risk of complications going unnoticed. This approach violates the principle of beneficence by not providing the necessary tools for a safe recovery and can be seen as a breach of professional responsibility. A third incorrect approach that neglects to provide contact information for emergencies or follow-up care creates a critical gap in patient support. In the event of unexpected complications, the patient may be unable to seek timely assistance, leading to potentially severe consequences. This failure to establish a clear communication pathway is a significant ethical and professional lapse, undermining patient safety and trust. Professional decision-making in postoperative care should involve a systematic assessment of the patient's procedure, their individual health status, and potential risks. This assessment should inform the development of a personalized postoperative plan that includes detailed instructions on wound care, pain management, diet, activity restrictions, and signs/symptoms to monitor. Crucially, this plan must include clear instructions on how and when to contact the healthcare provider for concerns or emergencies, ensuring continuity of care and patient safety. Question 2. Cost-benefit analysis shows that for a clinically suspicious but early-stage oral mucosal lesion, which diagnostic technique offers the optimal balance of diagnostic accuracy, patient safety, and resource efficiency within the U.S. healthcare framework? Option A. Routine follow-up with topical antimicrobial therapy. Option B. Incisional biopsy for definitive histopathological examination. Option C. Excisional biopsy with immediate surgical management based on gross appearance. Option D. Fine needle aspiration cytology of the lesion. The correct answer is C. Excisional biopsy with immediate surgical management based on gross appearance. Explanation. This scenario presents a common challenge in oral medicine, balancing diagnostic accuracy with patient well-being and resource utilization. The clinician must select the most appropriate diagnostic technique for a suspicious oral lesion, considering not only the potential for malignancy, but also the invasiveness, cost, and potential complications of each method. The American Board of Oral Medicine, ABOM, Diplomate certification, implies a commitment to evidence-based practice and adherence to established ethical and professional guidelines within the United States regulatory framework governing healthcare. The correct approach prioritizes a minimally invasive yet highly informative diagnostic technique that aligns with the principle of do no harm, while efficiently guiding further management. This involves selecting a method that provides sufficient diagnostic yield to differentiate benign from potentially malignant conditions, thereby avoiding unnecessary aggressive interventions or delays in definitive treatment. Adherence to established diagnostic algorithms and guidelines for oral lesions, as expected of ABOM diplomates, is paramount. An incorrect approach would involve either over-investigation with highly invasive or expensive procedures when less aggressive options are sufficient, or under-investigation leading to delayed diagnosis and potentially poorer outcomes. For instance, proceeding directly to a wide surgical excision without a biopsy for definitive histological diagnosis would be a significant ethical and regulatory failure, violating principles of informed consent and appropriate diagnostic workup. Similarly, relying solely on visual inspection and palpation for a lesion with concerning features, without obtaining tissue for microscopic examination, would fall short of the standard of care and could be considered negligent. The choice of diagnostic technique must be justified by the clinical presentation and the potential for serious pathology, always aiming for the least invasive method that provides the necessary diagnostic information. The professional decision-making process in such situations involves a systematic evaluation. First, a thorough clinical assessment, history, visual inspection, palpation. Second, consideration of differential diagnoses based on the clinical findings. Third, selection of the most appropriate diagnostic modality, weighing its diagnostic accuracy, invasiveness, cost, patient factors, and potential risks and benefits. And finally, interpretation of results and formulation of a definitive management plan. This iterative process ensures that patient care is optimized and aligned with professional standards and regulatory expectations. Question 3. Cost-benefit analysis shows that while aggressive management of oral lesions associated with a chronic systemic autoimmune disease can provide significant symptomatic relief, the potential for drug interactions and exacerbation of the underlying systemic condition necessitates careful consideration of treatment modalities. A patient with Sjogren's syndrome presents with severe oral candidiasis and xerostomia. The oral medicine specialist is considering various treatment options. Which of the following approaches best aligns with regulatory and ethical standards for managing oral manifestations in patients with complex systemic diseases? Option A. Prescribe a high-potency topical corticosteroid to reduce inflammation and discomfort associated with the candidiasis, without considering its potential impact on the patient's immune system. Option B. Initiate a course of systemic antifungal medication and recommend frequent salivary substitutes, without further consultation, assuming standard protocols are sufficient. Option C. Consult with the patient's rheumatologist to discuss the severity of the oral candidiasis and xerostomia, review the patient's current systemic medication regimen for potential interactions, and collaboratively develop a treatment plan that addresses both the oral symptoms and the systemic disease management. Option D. Advise the patient to discontinue all systemic medications for Sjogren's syndrome temporarily to simplify oral treatment and reduce the risk of interactions. The correct answer is B. Initiate a course of systemic antifungal medication and recommend frequent salivary substitutes, without further consultation, assuming standard protocols are sufficient. Explanation. Scenario analysis. This scenario presents a common challenge in oral medicine, where a patient with a systemic disease requires management of an oral manifestation. Challenge lies in balancing the immediate need for symptomatic relief and improved oral health with the potential systemic implications of treatment choices, especially when considering the patient's underlying condition and its management. The oral medicine specialist must navigate the complexities of drug interactions, potential exacerbation of systemic disease, and the patient's overall well-being, all within the framework of established clinical guidelines and ethical practice. Correct approach analysis. The correct approach prioritizes a comprehensive, multidisciplinary assessment and a treatment plan that is integrated with the patient's systemic care. This aligns with best professional practice by ensuring that oral health interventions do not negatively impact the patient's systemic condition or interfere with their ongoing medical management. Specifically, consulting with the patient's primary physician or relevant specialist is crucial for understanding the current status of the systemic disease, any contraindications to specific oral treatments, and potential drug interactions. This collaborative approach is ethically mandated to ensure patient safety and optimal outcomes, reflecting the principles of patient-centered care and evidence-based practice as expected within the American Board of Oral Medicine (ABOM) framework. The focus is on a holistic view of the patient, where oral health is an integral component of overall health. Incorrect approach is analysis, an approach that solely focuses on the oral manifestation without considering the systemic disease risks patient harm. For instance, prescribing a medication that could interact negatively with the patient's systemic medications or exacerbate their underlying condition would be a significant ethical and professional failure. This demonstrates a lack of due diligence and a failure to adhere to the principle of do no harm. Another incorrect approach would be to proceed with treatment based on standard oral medicine protocols without seeking input from the patient's medical team, potentially overlooking critical systemic factors that influence treatment efficacy and safety. This can lead to suboptimal care, treatment complications, and a breach of professional responsibility to manage the patient comprehensively. Furthermore, an approach that prioritizes rapid symptomatic relief over long-term safety and systemic integration will be considered substandard care. Professional reasoning. Professionals facing such scenarios should adopt a systematic decision-making process. This begins with a thorough medical history, including a detailed understanding of the patient's systemic disease, current treatments, and any known oral manifestations. The next step involves a comprehensive oral examination to assess the extent and nature of the oral condition. Crucially, consultation with the patient's primary physician or relevant specialist is paramount to gather essential information regarding the systemic disease and its management. Based on this integrated understanding, a differential diagnosis for the oral condition should be formulated, and potential treatment options should be evaluated for their safety and efficacy in the context of the patient's systemic health. The chosen treatment plan should be clearly communicated to the patient and their medical team, with provisions for ongoing monitoring and adjustment as needed. This iterative process ensures that oral health management is always aligned with the patient's overall health and well-being. Question 4. Quality control measures reveal a pattern of oral medicine specialists occasionally proceeding with definitive oral surgical interventions for patients with known autoimmune disorders without prior consultation with the patient's rheumatologist. These patients often present with oral ulcerations and xerostomia, and the oral medicine specialists are aware of the potential for immunosuppressive medications to affect healing and increase infection risk. What is the most appropriate and ethically sound approach for the oral medicine specialist in managing such a patient? Option A. Proceed with the oral surgical intervention as planned, assuming the patient's understanding of their condition and medications is sufficient, and document the patient's consent in the chart. Option B. Advise the patient to discontinue their immunosuppressive medication temporarily before the oral surgical intervention to minimize potential complications, without consulting their rheumatologist. Option C. Focus solely on managing the oral symptoms with palliative measures and defer any surgical intervention indefinitely, without seeking further medical input. Option D. Initiate a discussion with the patient's rheumatologist to understand the current status of their autoimmune disorder, the specific immunosuppressive medications being used, and any potential contraindications or precautions relevant to the proposed oral surgical intervention. Subsequently, present a comprehensive treatment plan to the patient, detailing the risks, benefits, and alternatives, including the implications for their systemic health, and obtain informed consent. The correct answer is D. Initiate a discussion with the patient's rheumatologist to understand the current status of their autoimmune disorder, the specific immunosuppressive medications being used, and any potential contraindications or precautions relevant to the proposed oral surgical intervention. Subsequently, present a comprehensive treatment plan to the patient, detailing the risks, benefits, and alternatives, including the implications for their systemic health, and obtain informed consent. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the oral medicine specialist to navigate the intersection of a patient's systemic health condition, their oral manifestations, and the potential impact of dental treatment on their overall well-being. The challenge lies in ensuring that the oral medicine specialist's actions are not only clinically sound from an oral health perspective, but also ethically and regulatorily compliant within the context of integrated healthcare, prioritizing patient safety and informed consent. The need for collaboration with the patient's primary care physician is paramount, as decisions made in the dental setting can have significant systemic implications. Correct approach analysis. The correct approach emphasizes a comprehensive, patient-centered, and collaborative strategy. By consulting with the patient's primary care physician, the oral medicine specialist ensures that any proposed oral treatment is aligned with the patient's overall medical management. This consultation is crucial for understanding potential drug interactions, contraindications, and the systemic impact of oral conditions or treatments. This aligns with the ethical principle of beneficence and non-maleficence, ensuring the patient receives the safest and most effective care. It also reflects the regulatory expectation for healthcare providers to communicate and coordinate care when a patient has complex medical needs, fostering a holistic approach to patient management. The focus on obtaining informed consent after a thorough discussion of risks, benefits, and alternatives, including the implications for their systemic condition, is a cornerstone of ethical and legal practice. Incorrect approaches analysis. One incorrect approach would be to proceed with definitive oral treatment without consulting the patient's primary care physician. This fails to acknowledge the interconnectedness of oral and systemic health, potentially leading to adverse drug interactions, exacerbation of the systemic condition, or delayed diagnosis of a more serious underlying issue. This constitutes a failure in the duty of care and a potential violation of professional standards that mandate interdisciplinary communication for complex patients. Another incorrect approach would be to solely rely on the patient's self-reported understanding of their systemic condition and its implications for oral health. While patient autonomy is important, it does not absolve the clinician of their responsibility to gather all necessary information and provide expert guidance. This approach risks overlooking critical medical information that could influence treatment decisions, thereby compromising patient safety and potentially leading to suboptimal outcomes. It also fails to meet the standard of care for managing patients with known systemic diseases. A third incorrect approach would be to dismiss the oral manifestations as unrelated to the systemic condition without proper investigation or consultation. This demonstrates a lack of understanding of the broad scope of oral medicine's role in identifying and managing systemic diseases that manifest orally. It represents a failure to adhere to the comprehensive diagnostic and management principles expected of an oral medicine specialist, and could lead to missed opportunities for early diagnosis and intervention of systemic disease. Professional reasoning. Professionals should approach such cases by first recognizing the potential for systemic involvement in oral conditions. A thorough medical history, including a detailed review of current medical conditions and medications, is essential. When a patient presents with a known systemic illness, the immediate next step should be to establish communication with their primary care physician or relevant specialist. This collaborative dialogue allows for a comprehensive understanding of the patient's overall health status and any potential contraindications or considerations for dental treatment. The oral medicine specialist must then integrate this medical information with their oral findings to formulate a treatment plan. This plan should be clearly communicated to the patient, including all potential risks, benefits, and alternatives, with particular attention to how the proposed treatment might interact with or be affected by their systemic condition. Informed consent must be obtained, ensuring the patient fully understands the implications of their treatment choices. This systematic, collaborative, and communicative approach ensures patient safety, optimizes treatment outcomes, and upholds professional and ethical standards. Question 5. Assessment of a periapical radiograph reveals a well-defined unilocular radiolucency at the apex of a vital mandibular premolar. The lesion appears to have a sclerotic border and does not exhibit internal trapulation. Clinically, the tooth is asymptomatic, and there is no swelling or tenderness in the surrounding tissues. Which of the following interpretations and subsequent management strategies best reflects a systematic and evidence-based approach to this radiographic finding? Option A. Interpret the finding as a periapical granuloma and recommend immediate surgical excision of the periapical lesion. Option B. Interpret the finding as a periapical cyst and recommend endodontic therapy followed by periodic radiographic monitoring. Option C. Interpret the finding as a periapical cemento-osseous dysplasia and recommend no immediate intervention, but rather clinical and radiographic follow-up. Option D. Interpret the finding as a periapical abscess and recommend immediate extraction of the tooth. The correct answer is B. Interpret the finding as a periapical cyst and recommend endodontic therapy followed by periodic radiographic monitoring. Explanation. The scenario presents a common challenge in oral medicine, interpreting radiographic findings that could represent multiple pathological processes, requiring a differential diagnosis and a systematic approach to management. The challenge lies in distinguishing between benign reactive changes, early neoplastic lesions, and established malignant conditions, all of which may exhibit overlapping radiographic features. Careful judgment is required to avoid both underdiagnosis, leading to delayed treatment of serious pathology, and overdiagnosis, resulting in unnecessary interventions and patient anxiety. The correct approach represents best professional practice by prioritizing a comprehensive clinical evaluation alongside radiographic interpretation. This aligns with established ethical guidelines for patient care, emphasizing the importance of integrating all available diagnostic information. Specifically, it reflects the principle of beneficence by seeking to accurately diagnose and treat the patient's condition, and non-maleficence by avoiding unnecessary procedures. The systematic approach of developing a differential diagnosis, considering clinical context, and planning further investigations based on the most likely diagnoses is a cornerstone of sound medical practice, as implicitly supported by professional standards of care expected of ABOM diplomates. An incorrect approach that relies solely on radiographic interpretation without considering clinical signs and symptoms is professionally unacceptable. This failure violates the ethical obligation to conduct a thorough patient assessment. It risks misinterpreting benign findings as malignant or vice versa, leading to inappropriate management decisions. Such an approach may also be considered a breach of the standard of care, as it neglects crucial components of the diagnostic process. Another incorrect approach that immediately proceeds to invasive biopsy without a well-reasoned differential diagnosis or consideration of less invasive diagnostic steps is also professionally unsound. A biopsy is often necessary. It should be guided by a reasoned clinical and radiographic assessment. Proceeding directly to biopsy without this preliminary evaluation can lead to unnecessary patient discomfort, risk of complications, and increased healthcare costs, potentially violating the principle of non-maleficence and prudent resource utilization. A further incorrect approach that dismisses significant radiographic findings as insignificant without further investigation or consultation is professionally negligent. This failure to adequately address potentially serious pathology can have severe consequences for the patient's prognosis and well-being, directly contravening the duty of care. The professional decision-making process for similar situations should involve 1. Meticulous review of all radiographic images, noting specific features such as radiolucency, radiopacity, margins, internal structure, and effect on surrounding structures. 2. Correlating these findings with the patient's detailed clinical history, including symptoms, duration, and any relevant medical or social history. 3. Performing a thorough intraoral and extraoral examination, looking for any corresponding clinical signs. 4. Developing a comprehensive differential diagnosis, ranking potential conditions from most to least likely based on the integrated clinical and radiographic data. 5. Planning appropriate further investigations, which may include advanced imaging, serological tests, or targeted biopsies to confirm or refute the differential diagnoses. 6. Communicating findings and treatment plans clearly to the patient, ensuring informed consent. Question 6. Comparative studies suggest that the interpretation of periapical radiolucencies in asymptomatic patients presents a diagnostic challenge. A 45-year-old male presents for a routine dental examination, and a periapical radiolucency is noted on a routine periapical radiograph of a vital mandibular premolar. The patient reports no pain, swelling, or history of trauma to the area. Which of the following diagnostic approaches best reflects current best practices in oral medicine for managing this finding? Option A. Recommend immediate endodontic therapy based on the presence of a radiolucency, regardless of vitality testing or clinical symptoms. Option B. Advise the patient that the finding is likely benign and requires no further investigation or follow-up. Option C. Refer the patient for a cone beam computed tomography, CBCT, scan immediately to assess the extent of the lesion and plan for surgical intervention. Option D. Correlate the radiographic finding with pulp vitality testing, periodontal probing, and consider a follow-up radiograph in 6-12 months if the tooth remains asymptomatic and vital. The correct answer is A. Recommend immediate endodontic therapy based on the presence of a radiolucency, regardless of vitality testing or clinical symptoms. Explanation. Scenario analysis. This scenario presents a common challenge in oral medicine where a clinician must interpret diagnostic imaging findings in the context of a patient's clinical presentation. Challenge lies in differentiating between benign findings that require observation and potentially serious pathologies that necessitate further investigation or intervention. Misinterpretation can lead to delayed diagnosis, inappropriate treatment, or unnecessary patient anxiety and expense. The clinician must balance the need for thoroughness with the avoidance of overinvestigation, all while adhering to established diagnostic protocols and ethical responsibilities. Correct approach analysis. The correct approach involves a systematic evaluation of the radiographic findings in conjunction with the patient's history, clinical examination, and any relevant laboratory data. This integrated approach ensures that imaging is not viewed in isolation, but as one component of a comprehensive diagnostic process. Best professional practice dictates that imaging findings should be correlated with clinical signs and symptoms to arrive at the most accurate diagnosis. This aligns with the ethical principle of beneficence, ensuring that diagnostic and treatment decisions are based on the best available evidence and patient-specific factors, thereby avoiding unnecessary procedures and promoting patient well-being. Regulatory frameworks for oral medicine emphasize evidence-based practice and patient-centered care, which this approach embodies. Incorrect approach is analysis. One incorrect approach is to solely rely on the radiographic appearance without considering the clinical context. This can lead to overdiagnosis or misdiagnosis, as radiographic features can be nonspecific and mimic various conditions. Ethically, this fails to uphold the standard of care by neglecting crucial patient information. It also risks violating the principle of non-maleficence by potentially subjecting the patient to unnecessary further investigations or treatments based on incomplete information. Another incorrect approach is to dismiss significant radiographic findings because they do not immediately align with the initial clinical suspicion. This can result in a delayed diagnosis of serious pathology, directly contravening the duty of care and potentially causing harm to the patient. Such an approach may also be seen as a failure to adhere to professional standards that require thorough investigation of all relevant findings. A third incorrect approach is to immediately recommend invasive procedures based on a single radiographic finding, without considering less invasive diagnostic alternatives or the need for serial imaging to monitor changes. This can lead to iatrogenic complications, unnecessary patient discomfort, and increased healthcare costs, failing to meet the ethical obligation to use the least harmful effective intervention. Professional reasoning. Professionals should approach diagnostic imaging interpretation with a structured decision-making process. This begins with a thorough patient history and clinical examination to formulate a differential diagnosis. Radiographic findings are then interpreted within this differential, seeking to confirm or refute specific diagnoses. If findings are equivocal or suggest a serious condition, further investigation, which may include serial imaging, biopsy, or consultation with specialists, should be considered based on the risk-benefit analysis for the individual patient. This iterative process ensures that diagnostic decisions are informed, evidence-based, and patient-centered, adhering to both ethical principles and regulatory expectations for competent practice in oral medicine. Question 7. Quality control measures reveal a discrepancy between the initial histopathological interpretation of a biopsy specimen from a patient with a suspicious oral lesion and the subsequent clinical course observed by the treating oral medicine specialist. The initial report, generated by a general pathologist, describes features suggestive of a benign inflammatory process, but the lesion has not responded to conservative management and has shown subtle changes in appearance over several weeks. Which of the following approaches best addresses this situation to ensure optimal patient care and diagnostic accuracy? Option A. Rebiopsy the lesion and send the new specimen to the same general pathologist for a comparative review with the initial report. Option B. Inform the patient that the initial diagnosis is likely correct and that the lack of response is due to other factors, without seeking further diagnostic clarification. Option C. Proceed with the initial diagnosis and continue conservative management, assuming the clinical changes are unrelated to the biopsy findings. Option D. Request a second, independent histopathological review of the original slides by a board-certified oral pathologist, and correlate these findings with the complete clinical history and examination. The correct answer is D. Request a second, independent histopathological review of the original slides by a board-certified oral pathologist, and correlate these findings with the complete clinical history and examination. Explanation. This scenario presents a professional challenge due to the potential for misinterpretation of histopathological findings, which can directly impact patient diagnosis, treatment planning, and prognosis. The ABOM Diplomate is expected to possess the highest level of expertise in oral medicine, including the accurate interpretation of biopsy specimens. Ensuring the quality and accuracy of these interpretations is paramount for patient safety and adherence to professional standards. The correct approach emphasizes a systematic and evidence-based review process, incorporating multiple layers of expert opinion and diagnostic confirmation. This aligns with the ethical obligation to provide the highest standard of care and the regulatory expectation for diligent and accurate diagnostic services. Specifically, seeking a second, independent expert opinion from a board-certified oral pathologist or a pathologist with extensive experience in oral pathology, coupled with a thorough review of the original slides and clinical correlation, represents best professional practice. This process minimizes the risk of diagnostic error, ensures that all relevant features are considered, and provides a robust foundation for clinical decision-making. It reflects a commitment to continuous quality improvement and patient advocacy, which are core tenets of professional conduct within the framework of oral medicine practice. Incorrect approaches fail to meet these standards, relying solely on the initial interpretation without further verification, especially when discrepancies are noted or when the findings are unusual or critical, constitutes a failure to exercise due diligence. This can lead to delayed or inappropriate treatment, potentially harming the patient and violating the principle of do no harm. Furthermore, neglecting to correlate histopathological findings with clinical presentation is a significant ethical and professional lapse. Oral medicine is inherently a clinical specialty, and diagnostic accuracy depends on integrating all available information. Failing to do so can result in misdiagnosis, as a lesion's appearance under the microscope must be understood within its clinical context. Disregarding established protocols for quality assurance or peer review, if such are mandated or recommended by professional bodies or institutional guidelines, also represents a failure to adhere to best practices and may have regulatory implications regarding the maintenance of professional competence and the provision of safe patient care. The professional reasoning process for similar situations should involve a critical self-assessment of the initial interpretation, especially when there is any doubt or when the findings are of significant clinical consequence. This should be followed by a proactive engagement with available resources for confirmation and validation. This includes consulting with colleagues, seeking second opinions from specialists with relevant expertise, and meticulously correlating all diagnostic data, including clinical history, radiographic findings, and gross examination of the specimen, with the histopathological interpretation. Adherence to established quality assurance protocols and a commitment to lifelong learning are essential components of maintaining diagnostic accuracy and providing optimal patient care. Question 8. To address the challenge of a patient with a confirmed diagnosis of oral lichen planus requesting a novel, unproven herbal supplement for treatment, despite the availability of well-established, evidence-based therapies, What is the most ethically and professionally sound course of action for an oral medicine specialist? Option A. Prescribe the requested herbal supplement as the patient has requested it, assuming patient autonomy supersedes the need for evidence-based treatment for this condition. Option B. Refuse to discuss the herbal supplement and immediately prescribe a standard therapy, informing the patient that their request is not medically valid. Option C. Recommend the herbal supplement alongside standard therapies without disclosing the lack of scientific evidence for the supplement's efficacy in treating oral lichen planus. Option D. Thoroughly discuss the patient's diagnosis. The lack of scientific evidence supporting the efficacy and safety of the requested herbal supplement for oral lichen planus. Present evidence-based treatment options, and collaboratively develop a treatment plan that respects the patient's autonomy while prioritizing their well-being. The correct answer is D. Thoroughly discuss the patient's diagnosis. The lack of scientific evidence supporting the efficacy and safety of the requested herbal supplement for oral lichen planus. Present evidence-based treatment options, and collaboratively develop a treatment plan that respects the patient's autonomy while prioritizing their well-being. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's desire for a specific treatment and the clinician's ethical and professional obligation to provide evidence-based care and avoid harm. The clinician must navigate the patient's autonomy while upholding their duty of care, particularly when the requested treatment lacks scientific validation for the diagnosed condition and carries potential risks. The correct approach represents best professional practice because it prioritizes patient safety and well-being through informed consent and evidence-based decision-making. It aligns with the core ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, it involves a thorough discussion of the diagnosis, the limitations of the requested treatment for the condition, the availability of scientifically supported alternatives, and the potential risks and benefits of all options. This ensures the patient can make an informed decision based on accurate information, respecting their autonomy while guiding them towards the most appropriate and safe course of action. This approach is consistent with the ethical guidelines governing the practice of oral medicine, which emphasize the importance of patient education and shared decision-making. An incorrect approach that involves proceeding with the unproven treatment without adequate discussion of its limitations and risks would represent a failure to uphold the principle of non-maleficence. It could also be construed as a violation of informed consent, as the patient would not be fully aware of the lack of evidence or potential harms. This could lead to patient dissatisfaction, potential adverse outcomes, and professional liability. Another incorrect approach, that of dismissing the patient's request outright without exploring their concerns or providing alternative evidence-based options, fails to respect patient autonomy and can damage the patient-clinician relationship. While the clinician has a duty to provide appropriate care, a collaborative approach that acknowledges the patient's perspective is crucial. This could lead to the patient seeking care elsewhere, potentially from less qualified individuals, or abandoning necessary treatment altogether. A professional decision-making process for similar situations should involve a systematic evaluation of the patient's request against established scientific literature and clinical guidelines. It requires open and honest communication, active listening to the patient's concerns and motivations, and a collaborative approach to developing a treatment plan that balances patient preferences with professional judgment and ethical obligations. The clinician must be prepared to educate the patient, explain the rationale behind their recommendations, and document the decision-making process thoroughly. Question 9. Market research demonstrates a growing prevalence of patients presenting with oral lesions that are suspected to be secondary to systemic autoimmune disorders. A 55-year-old female patient, diagnosed with Sjogren's syndrome 5 years ago, presents with multiple, non-healing erythematous erosions on the buccal mucosa and tongue, accompanied by significant xerostomia. She reports a history of recurrent diffuse stomatitis and candidiasis. The patient is currently managed by a rheumatologist and is taking hydroxychloroquine and occasional low-dose corticosteroids. Which of the following diagnostic and management strategies best reflects the current standards of practice in oral medicine for this patient? Option A. Refer the patient to an oral surgeon for surgical excision of the oral erosion, citing their persistent nature and potential for malignant transformation, and advise the patient to discontinue hydroxychloroquine due to its potential oral side effects. Option B. Prescribe a potent topical corticosteroid for the oral erosions and recommend over-the-counter salivary substitutes for xerostomia without further medical consultation, assuming the oral findings are solely a consequence of the known Sjogren syndrome. Option C. Obtain a detailed medical history including current medications and recent laboratory values. Consult with the patient's rheumatologist to discuss the oral findings and potential systemic influences, and consider a biopsy if the lesions do not improve with conservative management and optimize systemic therapy. Option D. Perform a biopsy of the most representative oral lesion for histopathological examination and initiate empirical antifungal therapy for suspected candidiasis, while advising the patient on rigorous oral hygiene measures. The correct answer is D. Perform a biopsy of the most representative oral lesion for histopathological examination and initiate empirical antifungal therapy for suspected candidiasis, while advising the patient on rigorous oral hygiene measures. Explanation. This scenario presents a professionally challenging situation due to the complex interplay between a patient's systemic disease, its oral manifestations, and the need for appropriate dental management within the established ethical and regulatory framework of the American Board of Oral Medicine, ABOM. The challenge lies in accurately diagnosing and managing oral conditions that are secondary to a systemic illness, requiring a comprehensive understanding of both oral medicine and the patient's overall health status. Careful judgment is required to differentiate primary oral pathology from manifestations of systemic disease, and to ensure that any proposed treatment is safe and effective, considering potential contraindications or interactions with the patient's systemic condition and its management. The correct approach represents best professional practice by prioritizing a thorough, evidence-based diagnostic process that integrates the patient's systemic health information with oral findings. This aligns with the ABOM commitment to advanced knowledge and clinical competence in oral medicine, which inherently involves understanding the systemic influences on oral health. Best practice dictates a systematic evaluation, including a detailed medical history, review of current medications, and consultation with the patient's primary care physician or relevant specialists when necessary. This collaborative approach ensures that oral health decisions are made in the context of the patient's complete medical picture, minimizing risks and optimizing outcomes, thereby upholding the ethical obligation to provide patient-centered care. An incorrect approach that relies solely on isolated oral findings without considering the systemic context would be professionally unacceptable. This failure to integrate medical history and systemic disease information represents a breach of the standard of care in oral medicine, as it can lead to misdiagnosis, inappropriate treatment, and potential harm to the patient. For instance, treating an oral lesion as a primary condition when it is a manifestation of an underlying systemic disease could delay crucial systemic diagnosis and management, violating the ethical principle of beneficence. Another incorrect approach might involve prescribing medications without considering potential interactions with the patient's systemic medications or contraindications related to their underlying disease, which could lead to adverse drug events and compromise patient safety, violating the ethical duty of non-maleficence. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive patient assessment. Begin with a detailed medical history, focusing on systemic conditions, current medications, allergies, and any relevant laboratory findings. 2. Clinical oral examination. Conduct a thorough intraoral and extraoral examination, noting the characteristics of any lesions or abnormalities. 3. Differential diagnosis. Formulate a list of potential diagnoses, considering both primary oral conditions and oral manifestations of systemic diseases. 4. Diagnostic adjuncts. Utilize appropriate diagnostic tools such as biopsies, microbial cultures, or serological tests as indicated. 5. Medical consultation. When systemic disease is suspected or known to be present, consult with the patient's physician or relevant specialists to obtain further information and coordinate care. 6. Treatment planning. Develop a treatment plan that addresses the oral condition while considering the patient's systemic health, potential treatment interactions, and the overall prognosis. 7. Patient education and follow-up. Educate the patient about their condition, treatment plan, and the importance of ongoing management of both oral and systemic health, with appropriate follow-up appointments. Question 10. Process analysis reveals that a patient presents with a painless, asymptomatic, exophytic lesion on the buccal mucosa that has been present for approximately 6 months. The lesion is firm to palpation, has a smooth surface, and measures 1.5 cm in diameter. While the patient reports no systemic symptoms, the lesion's firm consistency and duration raise concerns for potential neoplastic processes. Considering the differential diagnosis, which of the following represents the most appropriate next step in patient management? Option A. Advise the patient to monitor the lesion for any changes and schedule a follow-up appointment in 1 year. Option B. Prescribe a broad-spectrum antibiotic and instruct the patient to return if symptoms worsen. Option C. Recommend a biopsy for histological examination to obtain a definitive diagnosis. Option D. Initiate empirical treatment with a topical antifungal agent and reassess in 2 weeks. Correct answer is C. Recommend a biopsy for histological examination to obtain a definitive diagnosis. Explanation. Scenario analysis. This scenario presents a common challenge in oral medicine, differentiating between a benign reactive lesion and a potentially malignant or metastatic process based on clinical presentation alone. The professional challenge lies in the subtle overlap of clinical features, potential for serious patient outcomes if misdiagnosed, and the ethical imperative to provide accurate and timely care within the scope of practice. Careful judgment is required to balance the need for definitive diagnosis with patient comfort and resource utilization. Correct approach analysis. The correct approach involves a systematic diagnostic process that prioritizes obtaining a definitive histological diagnosis when clinical suspicion warrants it. This aligns with the ethical and professional standards of oral medicine, which emphasize evidence-based practice and patient safety. The American Board of Oral Medicine, ABOM, Diplomate certification signifies a high level of expertise in diagnosing and managing oral diseases, including those with malignant potential. Therefore, recommending a biopsy for histological examination when a lesion's nature is uncertain is the most responsible and professionally sound course of action. This approach ensures that the patient receives the most accurate diagnosis, allowing for appropriate management and prognosis. It upholds the principle of do no harm by actively seeking to rule out serious pathology. Incorrect approaches analysis. One incorrect approach involves solely relying on clinical observation and patient history without pursuing a definitive diagnosis. This is professionally unacceptable because clinical appearance can be misleading, and many oral pathologies, including early-stage malignancies, may present with nonspecific signs. This failure to seek histological confirmation violates the principle of due diligence and can lead to delayed diagnosis and treatment, significantly impacting patient outcomes. It also fails to meet the standard of care expected of an oral medicine specialist. Another incorrect approach is to immediately initiate aggressive treatment based on a presumptive diagnosis without histological confirmation. While some reactive lesions might respond to conservative management, this approach carries the risk of treating a potentially malignant lesion inappropriately or unnecessarily intervening in a benign process. This can lead to patient harm, financial burden, and a failure to address the underlying pathology effectively. It bypasses the critical step of establishing a definitive diagnosis, which is fundamental to evidence-based medicine. A further incorrect approach is to dismiss the lesion as benign without adequate consideration of differential diagnoses that include malignant or premalignant conditions. This demonstrates a lack of thoroughness in the diagnostic process, and a potential underestimation of the seriousness of oral lesions can result in overlooking critical findings and failing to provide timely referral or intervention for potentially life-threatening diseases. This approach falls short of the comprehensive diagnostic skills expected of an ABOM diplomate. Professional reasoning. Professionals faced with such a scenario should employ a structured decision-making process. This begins with a thorough clinical examination, detailed patient history, and consideration of the differential diagnosis. When clinical features are ambiguous or raise suspicion for serious pathology, the next critical step is to recommend appropriate diagnostic procedures, with biopsy for histological examination being the gold standard for definitive diagnosis of oral lesions. This systematic approach ensures that patient care is guided by accurate information and adheres to the highest professional and ethical standards. Question 11. Governance review demonstrates a patient presenting for evaluation of oral lesions has a complex medical history including uncontrolled hypertension, type 2 diabetes mellitus, and a history of anaphylaxis to penicillin. The patient is currently taking lisinopril, metformin, and an unspecified over-the-counter analgesic. The oral medicine specialist is considering prescribing a topical corticosteroid for the oral lesions. Which of the following approaches best represents a comprehensive risk assessment in this scenario? Option A. Conduct a thorough review of the patient's complete medical history, including all current medications, known allergies and comorbidities, to identify potential contraindications, drug interactions, and systemic factors influencing oral health before initiating any treatment. Option B. Prescribe the topical corticosteroid and advise the patient to discontinue their over-the-counter analgesic without further investigation into potential interactions or systemic implications. Option C. Focus solely on the oral lesions and the patient's chief complaint, assuming their systemic health issues are unrelated to the oral presentation. Option D. Prescribe the topical corticosteroid immediately, as it is a localized treatment and unlikely to be affected by the patient's systemic conditions or medications. The correct answer is A. Conduct a thorough review of the patient's complete medical history, including all current medications, known allergies and comorbidities, to identify potential contraindications, drug interactions, and systemic factors influencing oral health before initiating any treatment. Explanation. Scenario analysis. This scenario is professionally challenging because the patient presents with a complex medical history that includes multiple comorbidities and a history of adverse drug reactions. The oral medicine specialist must synthesize this information to accurately assess the risk of oral manifestations and potential drug interactions related to proposed oral therapies. Failure to conduct a thorough risk assessment could lead to inappropriate treatment, adverse patient outcomes, and potential professional liability. Correct approach analysis. The correct approach involves a comprehensive and systematic review of the patient's entire medical history, including current medications, allergies, and past medical conditions. This allows for the identification of potential oral health risks, such as xerostomia, candidiasis, or lichenoid reactions, which may be exacerbated by existing conditions or medications. Furthermore, it enables the specialist to anticipate and mitigate potential drug-drug interactions between prescribed oral medications and the patient's existing pharmacotherapy. This aligns with the ethical and professional obligation to provide patient-centered care, ensuring safety and efficacy of treatment, as implicitly guided by professional standards of practice in oral medicine, which emphasize thorough patient evaluation. Incorrect approach is analysis. One incorrect approach is to focus solely on the chief complaint without adequately exploring the patient's broader medical context. This neglects the interconnectedness of systemic health and oral health, potentially leading to misdiagnosis or inappropriate management of oral conditions. Ethically, this represents a failure to provide comprehensive care and a deviation from the standard of practice expected of a specialist. Another incorrect approach is to dismiss the significance of reported adverse drug reactions without further investigation. This could lead to prescribing medications that the patient has previously reacted to, posing a direct risk to their safety and well-being. This demonstrates a lack of due diligence and a disregard for patient-reported history, which is a critical component of risk assessment. A third incorrect approach is to rely solely on a brief, superficial review of the patient's medication list without considering the potential for interactions with proposed oral treatments. This overlooks the complex pharmacokinetic and pharmacodynamic interactions that can occur, potentially leading to increased toxicity or reduced efficacy of medications. This is a failure to apply a critical analytical lens to the patient's pharmacotherapy, which is essential for safe practice. Professional reasoning. Professionals should employ a structured approach to patient history taking and risk assessment. This involves active listening, open-ended questioning, and a systematic review of all relevant medical information. When faced with complex histories, it is crucial to correlate systemic conditions with oral findings and to meticulously evaluate potential drug interactions. If uncertainty exists, consultation with the patient's primary care physician or other specialists is warranted to ensure optimal patient care and safety. Question 12. Consider a scenario where a general dentist identifies a persistent, non-healing ulcer on the buccal mucosa of a patient that has been present for 6 weeks. The lesion is approximately 1 cm in diameter, with raised, indurated borders and a central erythematous base. The patient reports no history of trauma and denies any recent systemic illness. The dentist has considered common causes of oral ulcers, but is uncertain about the definitive diagnosis and appropriate management given the lesion's duration and atypical features. Which of the following actions best defines the scope of oral medicine in addressing this patient's condition? Option A. Referral to an oral medicine specialist for definitive diagnosis and management. Option B. Reassurance of the patient and observation of the lesion for another month. Option C. Referral to a general physician for evaluation of potential systemic causes. Option D. Attempting conservative management with topical corticosteroids and follow-up in 2 weeks. The correct answer is A. Referral to an oral medicine specialist for definitive diagnosis and management. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misdiagnosis and inappropriate treatment when a condition falls at the intersection of general dentistry and oral medicine. The dentist's responsibility is to recognize the limits of their expertise and ensure the patient receives care within the appropriate scope of practice, which in this case involves a condition that requires specialized knowledge beyond routine dental procedures. Correct approach analysis. The correct approach, which involves referring the patient to an oral medicine specialist, represents best professional practice because it aligns with the definition and scope of oral medicine as a dental specialty. Oral medicine encompasses the diagnosis and non-surgical management of diseases and conditions affecting the oral and maxillofacial region. A lesion that is persistent, unusual in appearance, or suggestive of a systemic link falls squarely within this domain, requiring the specialized diagnostic skills and treatment planning capabilities of an oral medicine diplomate. This ensures the patient receives accurate diagnosis and evidence-based management, adhering to ethical obligations of patient welfare and professional competence. Incorrect approach is analysis. Referring the patient to a general physician without first consulting an oral medicine specialist is an incorrect approach because it bypasses the dental specialty specifically trained to manage oral conditions. While a general physician can address systemic issues, they may lack the nuanced understanding of oral pathology required for accurate diagnosis and management of oral lesions. This could lead to delays in appropriate care or misdirected treatment. Attempting to manage the lesion with conservative dental treatments without a definitive diagnosis is professionally unacceptable. This approach risks masking the underlying pathology, delaying definitive diagnosis, and potentially allowing a serious condition to progress. It violates the principle of providing evidence-based care and could be considered negligent if the lesion proves to be malignant or requires specific systemic management. Simply observing the lesion without further action or referral is also an incorrect approach. Persistent oral lesions, especially those with atypical features, warrant investigation. Failure to act or refer demonstrates a lack of diligence and a potential disregard for the patient's health, as it allows a potentially serious condition to go unaddressed. Professional reasoning. Professionals should employ a systematic decision-making process when faced with unusual oral findings. This involves 1. Thorough clinical examination and patient history. 2. Consideration of differential diagnoses based on clinical presentation. 3. Recognition of personal limitations in the scope of one's practice. 4. Consultation with relevant specialists when a condition falls outside routine management or requires specialized diagnostic expertise. 5. Prioritizing patient safety and timely, appropriate care. In this case, the persistent, unusual nature of the lesion necessitates referral to the specialty best equipped to handle it. Question 13. The investigation demonstrates a patient with a history of a mechanical prosthetic mitral valve who is scheduled for a routine dental cleaning and prophylaxis. The patient has no other significant cardiac history or comorbidities. Considering the current guidelines for antibiotic prophylaxis in dental procedures, which of the following represents the most appropriate management strategy? Option A. Administer clindamycin 600 mg orally 1 hour before the procedure. Option B. Administer amoxicillin 2 grams orally 1 hour before the procedure. Option C. No antibiotic prophylaxis is indicated for this patient. Option D. Administer azithromycin 500 milligrams orally 1 hour before the procedure. The correct answer is B. Administer amoxicillin 2 grams orally 1 hour before the procedure. Explanation. The investigation demonstrates a common clinical scenario where a patient with a history of a prosthetic heart valve requires an invasive dental procedure. The professional challenge lies in balancing the risk of infective endocarditis with the potential for antibiotic resistance and adverse drug reactions. Careful judgment is required to adhere to current evidence-based guidelines, while individualizing care based on the patient's specific medical history and the nature of the dental procedure. The correct approach represents best professional practice by aligning with the most current recommendations from recognized professional organizations, such as the American Heart Association, AHA, and the American Dental Association, ADA, which are the primary regulatory and guideline bodies for antibiotic prophylaxis in the United States for dental procedures. These guidelines emphasize a risk-stratified approach, recommending prophylaxis only for patients at highest risk of adverse outcomes from endocarditis, and for specific procedures that carry a higher risk of bacteremia. This approach minimizes unnecessary antibiotic use, thereby reducing the risk of resistance and side effects, while adequately protecting vulnerable patients. An incorrect approach that recommends routine prophylaxis for all patients with prosthetic heart valves undergoing any dental procedure fails to adhere to current evidence-based guidelines. This overprescription of antibiotics contributes to the development of antibiotic resistance, a significant public health concern, and exposes patients to unnecessary risks of allergic reactions and gastrointestinal upset. Ethically, it violates the principle of beneficence by exposing the patient to potential harm without a clear, evidence-based benefit. Another incorrect approach that omits prophylaxis for a patient with a prosthetic heart valve undergoing a procedure known to cause significant bacteremia without a clear contraindication or alternative risk assessment would be a failure to adequately protect a high-risk patient. This could lead to a serious and potentially fatal infection, violating the principle of non-maleficence and failing to meet the standard of care. A further incorrect approach that relies on outdated or anecdotal recommendations rather than current, evidence-based guidelines demonstrates a lack of commitment to continuous professional development and adherence to established best practices. This can lead to suboptimal patient care and potential adverse outcomes. A professional decision-making process for similar situations should involve a thorough review of the patient's medical history, identification of cardiac conditions that confer a high risk of endocarditis, assessment of the dental procedure's potential for bacteremia, and strict adherence to the latest guidelines from authoritative bodies like the AHA and ADA. Consultation with the patient's cardiologist may be warranted in complex cases. Question 14. Upon reviewing the medical history of a 68-year-old patient presenting with symptomatic oral lichen planus, you note they are currently taking lisinopril for hypertension, metformin for type 2 diabetes, and atorvastatin for hyperlipidemia. The patient expresses significant discomfort and a desire for prompt relief. What is the most appropriate initial step in managing this patient's oral lichen planus pharmacologically? Option A. Recommend an over-the-counter topical analgesic, such as benzocaine, to provide symptomatic relief while deferring definitive pharmacological treatment until a later date. Option B. Prescribe a topical corticosteroid, such as clobtasol propionate, after confirming no contraindications with the patient's current medications through a comprehensive drug interaction check and consultation with their primary care physician if any potential concerns arise. Option C. Initiate treatment with a topical calcineurin inhibitor, such as tacrolimus, without further investigation, assuming it will be well tolerated given the patient's age. Option D. Immediately prescribe a systemic corticosteroid such as prednisone to rapidly reduce inflammation and alleviate the patient's discomfort, as oral lichen planus can be debilitating. The correct answer is B. Prescribe a topical corticosteroid, such as clobtasol propionate, after confirming no contraindications with the patient's current medications through a comprehensive drug interaction check and consultation with their primary care physician if any potential concerns arise. Explanation. This scenario presents a common clinical challenge in oral medicine, managing a patient with a complex medical history and multiple medications, requiring the judicious use of pharmacotherapy for an oral condition. The challenge lies in balancing the need for effective treatment of the oral condition with the potential for drug interactions, adverse effects, and the impact on the patient's overall health status. Careful judgment is required to select an appropriate medication that is both efficacious and safe, considering the patient's specific comorbidities and current drug regimen. The correct approach represents best professional practice by prioritizing a comprehensive assessment of the patient's medical history and current medications before initiating treatment. This aligns with the ethical and professional obligation to provide patient-centered care, ensuring patient safety and minimizing the risk of harm. Specifically, consulting with the patient's primary care physician or specialist is a crucial step in identifying potential drug interactions and contraindications, thereby optimizing therapeutic outcomes and preventing adverse events. This collaborative approach is implicitly supported by professional guidelines emphasizing interdisciplinary communication and evidence-based practice. An incorrect approach that involves prescribing a medication without a thorough review of the patient's medical history and current medications fails to meet the standard of care. This oversight could lead to serious adverse drug reactions, exacerbation of existing medical conditions, or rendering other prescribed medications ineffective. Such an approach demonstrates a lack of due diligence and a disregard for patient safety, potentially violating ethical principles of beneficence and non-maleficence. Furthermore, it may contravene professional practice standards that mandate a thorough patient assessment prior to prescribing. Another incorrect approach, such as choosing the most potent medication available without considering the patient's specific needs and risk factors, is also professionally unacceptable. This demonstrates a failure to individualize treatment and may result in unnecessary side effects or toxicity. It neglects the principle of prescribing the lowest effective dose for the shortest necessary duration, a cornerstone of rational pharmacotherapy. The professional reasoning process for similar situations should involve a systematic approach. 1. Thorough patient history taking, including medical conditions, allergies, and all current medications, prescription, over-the-counter, and supplements. 2. Identification of the oral condition and its severity. 3. Review of the pharmacological options for treating the oral condition, considering their mechanisms of action, efficacy, and known side effects. 4. Crucially, a detailed assessment of potential drug interactions between the proposed oral medication and the patient's existing pharmacotherapy. This may involve consulting drug interaction databases or seeking expert advice. 5. Consideration of the patient's comorbidities and their potential impact on drug metabolism, excretion, and overall tolerability. 6. Selection of the most appropriate medication, considering efficacy, safety, patient preference, and cost. 7. Clear communication with the patient regarding the medication, its purpose, potential side effects, and any necessary precautions. 8. Follow up to monitor efficacy and assess for any adverse reactions. Question 15. The performance metrics show a slight increase in the incidence of oral squamous cell carcinoma (OSC) within the practice's patient population over the past year, prompting a review of diagnostic protocols for suspicious lesions. A 55-year-old male patient presents with a non-healing, slightly indurated erythematous patch on the lateral border of his tongue that has been present for approximately 6 weeks. He reports a 30-pack-year history of smoking and occasional alcohol consumption. He denies any recent trauma to the area. Considering the established diagnostic pathways and management principles for oral cancer as outlined by the American Board of Oral Medicine, ABOM, guidelines and relevant U.S. regulatory frameworks, which of the following diagnostic and initial management approaches is most appropriate? Option A. Refer the patient immediately to an oral surgeon for a consultation and potential biopsy, without performing any initial diagnostic steps in the current practice. Option B. Recommend symptomatic treatment with a topical antifungal agent and schedule a follow-up appointment in 2 months to reassess the lesion. Option C. Advise the patient to rinse with warm salt water and monitor the lesion, suggesting he return if it significantly worsens or changes in appearance. Option D. Perform a thorough clinical examination, obtain a detailed patient history including all relevant risk factors, and schedule an excisional biopsy of the lesion for definitive histopathological diagnosis. The correct answer is B. Recommend symptomatic treatment with a topical antifungal agent and schedule a follow-up appointment in 2 months to reassess the lesion. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the potential for delayed diagnosis and treatment of oral cancer, which can significantly impact patient prognosis. The challenge lies in accurately interpreting clinical findings, understanding the multifactorial nature of risk, and implementing a timely and appropriate management plan within the established standards of care for oral medicine. The physician must balance diagnostic urgency with patient comfort and resource allocation, all while adhering to professional ethical obligations and regulatory guidelines. Correct approach analysis. The correct approach, involving a thorough clinical examination, detailed patient history focusing on risk factors, and appropriate biopsy for definitive diagnosis, represents best professional practice. This aligns with the American Board of Oral Medicine, ABOM Diplomate standards, which emphasize evidence-based diagnosis and management. The American Dental Association, ADA, Principles of Ethics and Code of Professional Conduct, as well as relevant state dental practice acts, mandate that dentists provide the highest level of care, which includes timely diagnosis and referral when necessary. Biopsy is the gold standard for definitive diagnosis of oral cancer, and its timely performance is critical for initiating appropriate treatment protocols, thereby maximizing the chances of successful outcomes and adhering to the principle of beneficence. Incorrect approach is analysis, an approach that delays definitive diagnosis by relying solely on symptomatic management without further investigation, fails to meet the standard of care. This constitutes a breach of the dentist's ethical duty to diagnose and treat, potentially violating the principle of non-maleficence by allowing a potentially life-threatening condition to progress. Regulatory failure would occur if this delay led to adverse patient outcomes, potentially resulting in disciplinary action by the state dental board for negligence or incompetence. An approach that dismisses the patient's concerns based on a superficial examination, without a comprehensive history of risk factors, is also professionally unacceptable. This demonstrates a lack of due diligence and can lead to misdiagnoses. Ethically, it violates the principle of patient autonomy by not taking their concerns seriously, and the principle of beneficence by not acting in their best interest. Regulatory failure could arise from a pattern of such dismissive behavior, indicating a failure to uphold professional responsibilities. An approach that defers definitive management solely to a specialist without initial diagnostic steps, while referral is often appropriate, can be problematic if it unnecessarily delays the diagnostic process. If the initial clinician has the expertise to perform a biopsy and initiate preliminary management, delaying this without clear justification can be seen as a failure to act promptly, potentially impacting patient outcomes and violating the principle of beneficence. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive clinical assessment, including a detailed history of relevant risk factors, e.g., tobacco use, alcohol consumption, HPV exposure, family history, chronic irritation. This is followed by a thorough intraoral and extraoral examination. Any suspicious lesions or findings warrant further investigation, which may include adjunctive diagnostic aids, but ultimately, a biopsy is crucial for definitive diagnosis. The decision to refer to a specialist should be based on the complexity of the case, the need for advanced surgical or oncological management, or when diagnostic uncertainty persists. Throughout this process, clear communication with the patient regarding findings, potential diagnoses, and the rationale for proposed investigations and management is paramount, upholding the principles of informed consent and patient trust. Question 16. Examination of the data shows a 55-year-old male patient presenting with a 6-month history of a firm, non-tender, sessile 1.5 cm exophytic lesion on the lateral border of the tongue. The lesion is uniformly white and has not changed in size or appearance. The patient denies any pain, bleeding, or functional impairment. He has a 30-year smoking history, but denies alcohol consumption. What is the most appropriate next step in the management of this patient? Option A. Perform an incisional or excisional biopsy for histopathological examination. Option B. Reassure the patient that the lesion is likely benign given its asymptomatic nature and duration. Option C. Prescribe a topical corticosteroid to reduce inflammation. Option D. Advise the patient to discontinue smoking and monitor the lesion for resolution. The correct answer is A. Perform an incisional or excisional biopsy for histopathological examination. Explanation. Scenario analysis. a patient presents with a persistent, asymptomatic oral lesion that has been present for several months. The challenge lies in differentiating between a benign, non-neoplastic condition and a potentially malignant or early neoplastic process. This requires a thorough understanding of oral pathology, differential diagnosis, and appropriate diagnostic pathways, all within the framework of established clinical practice guidelines for oral medicine. The asymptomatic nature of the lesion adds complexity, as it may lead to delayed patient presentation or a less urgent approach if not managed systematically. Correct approach analysis. The correct approach involves a systematic diagnostic process that prioritizes patient safety and evidence-based practice. This includes a comprehensive clinical examination, detailed patient history, and crucially, obtaining a biopsy for definitive histopathological diagnosis. This aligns with the American Board of Oral Medicine, ABOM, Diplomate standards, which emphasize accurate diagnosis and appropriate management of oral lesions. A biopsy is the gold standard for differentiating non-neoplastic lesions from neoplastic ones, ensuring that any concerning findings are identified and managed promptly, thereby adhering to ethical obligations of providing competent care and minimizing potential harm. Incorrect approaches analysis. One incorrect approach is to rely solely on clinical appearance and patient history without further investigation. This fails to meet the diagnostic rigor expected of an oral medicine specialist. Clinically, many non-neoplastic lesions can mimic early malignancies, and a definitive diagnosis cannot be made on visual inspection alone. This approach risks misdiagnosis, delayed treatment of potentially serious conditions, and a failure to adhere to best practices in oral pathology. Another incorrect approach is to prescribe empirical treatment for a suspected non-neoplastic lesion without obtaining a biopsy. While some inflammatory or reactive lesions may respond to treatment, this approach carries the risk of masking a more serious underlying pathology. If the lesion is indeed neoplastic or precancerous, empirical treatment will not resolve it and will further delay definitive diagnosis and management, potentially leading to a worse prognosis for the patient. This deviates from the principle of obtaining a definitive diagnosis before initiating treatment for persistent or concerning lesions. A third incorrect approach is to dismiss the lesion as benign based on its asymptomatic nature and duration. Asymptomatic lesions can still represent significant pathology, including early-stage cancers or precancerous conditions. The absence of symptoms does not equate to the absence of disease. This approach neglects the critical need for thorough investigation of all persistent oral lesions, regardless of their subjective presentation, and fails to uphold the professional responsibility to rule out serious pathology. Professional reasoning. Professionals should approach persistent oral lesions with a high index of suspicion and a systematic diagnostic strategy. This involves a detailed clinical assessment, a comprehensive history, and, for any lesion that does not resolve with conservative management or is concerning in appearance, a biopsy for histopathological examination. This stepwise approach ensures that all possibilities are considered, patient safety is prioritized, and treatment is guided by a definitive diagnosis, thereby adhering to the highest standards of oral medicine practice. Question 17. Performance analysis shows that a patient presents with a persistent, non-healing ulcer on the ventral tongue, accompanied by mild xerostomia and a generalized erythematous rash on the trunk. The dentist's initial clinical assessment suggests a differential diagnosis that includes lichen planus, a viral etiology, and a potential systemic autoimmune condition. Which of the following laboratory testing strategies best reflects a judicious and diagnostically relevant approach? Option A. A broad-spectrum viral serology panel for common oral viruses and a fungal culture of the oral lesion. Option B. A biopsy of the oral lesion for histopathological examination and direct immunofluorescence. Option C. A comprehensive autoimmune panel including anti-nuclear antibodies ANA, anti-SSA, Rho, and anti-SSB La antibodies, along with a complete blood count CBC with differential and basic metabolic panel BMP. Option D. A complete blood count CBC with differential liver function tests LFT, and a rapid plasma region RPR test. Correct answer is C. A comprehensive autoimmune panel including anti-nuclear antibodies, ANA, anti-SSA Rho, and anti-SSB La antibodies, along with a complete blood count CBC with differential and basic metabolic panel, BMP. Explanation. Scenario analysis. This scenario presents a common diagnostic challenge in oral medicine, where a patient exhibits symptoms suggestive of a systemic condition that can manifest orally. The challenge lies in differentiating between a localized oral process and a manifestation of a broader systemic disease, requiring a systematic approach to diagnosis that integrates clinical findings with laboratory investigations. The dentist must consider the differential diagnoses and select the most appropriate and cost-effective laboratory tests to confirm or exclude these possibilities, adhering to ethical and professional standards of care. Correct approach analysis. The correct approach involves a comprehensive clinical assessment to formulate a differential diagnosis, followed by the judicious selection of laboratory tests that are most likely to yield diagnostically relevant information for the suspected conditions. This aligns with the principles of evidence-based dentistry and responsible resource utilization. Ordering tests that are directly indicated by the clinical presentation and differential diagnosis ensures that the investigation is targeted, efficient, and minimizes unnecessary patient exposure to potential risks and financial burdens associated with superfluous testing. This approach is ethically sound, prioritizing patient well-being and avoiding unnecessary medical interventions. Incorrect approaches analysis. Ordering a broad, nonspecific panel of laboratory tests without a clear clinical indication is an inefficient and potentially harmful approach. This can lead to the discovery of incidental findings that may be clinically insignificant but cause patient anxiety and lead to further unnecessary investigations and costs. Ethically, this approach fails to uphold the principle of beneficence by not acting in the patient's best interest and potentially causing harm through over-investigation. It also fails to demonstrate professional competence by not applying a systematic diagnostic process. Focusing solely on a single, less likely diagnosis without considering other plausible differentials based on the clinical presentation would be a significant diagnostic error. This narrow focus could lead to overlooking the true underlying cause of the patient's symptoms, delaying appropriate treatment, and potentially worsening the patient's condition. This represents a failure in clinical judgment and a breach of the duty of care owed to the patient. Recommending invasive diagnostic procedures without first exhausting less invasive, appropriate laboratory investigations would be premature and potentially unnecessary. This approach disregards the principle of least harm and could expose the patient to risks and discomfort without adequate justification. It also demonstrates a lack of systematic diagnostic reasoning. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough history and physical examination to develop a comprehensive differential diagnosis. This is followed by a critical evaluation of the likelihood of each differential diagnosis. Based on this assessment, the clinician should then select laboratory tests that are most sensitive and specific for the leading differential diagnoses, considering the potential benefits, risks, and costs of each test. The results of these initial investigations should then guide further diagnostic steps, including the consideration of more invasive procedures if necessary. This iterative process ensures a rational and evidence-based approach to diagnosis, prioritizing patient safety and effective management. Question 18. The risk matrix shows a patient with a persistent, non-healing ulcerated lesion on the lateral border of the tongue, exhibiting induration and a rolled border. The differential diagnosis includes squamous cell carcinoma, benign reactive lesions, and infectious etiologies. Which diagnostic approach offers the most definitive characterization of this lesion for appropriate management? Option A. Close clinical observation and follow-up appointments every 3 months. Option B. Topical application of antifungal and antiviral medications. Option C. Incisional biopsy with histopathological examination. Option D. Cytological smear of the lesion for microscopic analysis. The correct answer is C. Incisional biopsy with histopathological examination. Explanation. The risk matrix shows a patient presenting with a suspicious oral lesion. The challenge lies in selecting the most appropriate diagnostic technique to accurately characterize the lesion, guide treatment, and ensure patient safety, all while adhering to the ethical and professional standards expected of an ABOM diplomate. This requires a nuanced understanding of various diagnostic modalities and their limitations in the context of oral pathology. The correct approach involves utilizing a combination of clinical examination and biopsy with histopathological analysis. This represents best professional practice because it provides the highest level of diagnostic certainty for oral lesions. Clinical examination allows for initial assessment of the lesion's characteristics, while a biopsy provides definitive tissue for microscopic evaluation by a pathologist. This integrated approach is supported by the principles of evidence-based dentistry and the ethical obligation to provide the highest standard of care. The ABOM focus on oral medicine implies a commitment to accurate diagnosis and management of oral diseases, which is best achieved through definitive diagnostic methods. An incorrect approach would be to rely solely on clinical examination without further investigation. This fails to meet the professional standard of care, as it lacks the definitive diagnostic information required for accurate diagnosis and management of potentially serious oral pathologies. Ethically, this could be considered negligence as it delays or omits necessary diagnostic steps. Another incorrect approach would be to recommend empirical treatment without a definitive diagnosis. This is professionally unsound as it risks inappropriate treatment, potential harm to the patient, and failure to address the underlying pathology. It also bypasses the crucial diagnostic step of obtaining a definitive diagnosis, which is a core responsibility in oral medicine. The professional decision-making process for similar situations should involve a systematic evaluation of the lesion, considering its clinical presentation, patient history, and potential differential diagnoses. This should then guide the selection of the most appropriate diagnostic modality, prioritizing those that offer the highest degree of diagnostic accuracy and specificity. Consultation with specialists, such as oral pathologists or oral surgeons, may be warranted when diagnostic uncertainty exists. The ultimate goal is to arrive at a definitive diagnosis to ensure optimal patient outcomes and adherence to ethical and professional responsibilities. Question 19. Analysis of the historical development of oral medicine reveals several key periods and influences. Which of the following best characterizes the foundational era that established oral medicine as a distinct discipline within dentistry? Option A. The era characterized by the widespread adoption of advanced imaging technologies for diagnosing oral pathologies. Option B. Period marked by the early recognition of oral mucosal diseases as a significant area of study, leading to the establishment of dedicated training programs and the advocacy for oral medicine as a dental specialty. Option C. The period focused on the development of surgical techniques for the removal of oral tumors. Option D. The time when general practitioners began to routinely refer patients with oral lesions to dermatologists. The correct answer is B. The period marked by the early recognition of oral mucosal diseases as a significant area of study, leading to the establishment of dedicated training programs and the advocacy for oral medicine as a dental specialty. Explanation. The scenario presents a challenge in understanding the foundational evolution of oral medicine as a distinct specialty, requiring an appreciation for its historical trajectory and the key figures and institutions that shaped its identity. This is professionally challenging because a superficial understanding can lead to misinterpretations of current practices and future directions, potentially impacting patient care and professional development. Careful judgment is required to distinguish between significant milestones and less impactful developments. The correct approach represents best professional practice because it demonstrates a comprehensive grasp of the historical context that underpins the current scope and practice of oral medicine. Understanding the early recognition of oral mucosal diseases as a distinct area of study, the establishment of formal training programs, and the contributions of pioneers who advocated for its recognition as a dental specialty are crucial. This historical perspective informs the ethical imperative to uphold the integrity of the specialty and to build upon its legacy. It aligns with the ABOM commitment to advancing the knowledge and practice of oral medicine, which is inherently rooted in its historical development. An incorrect approach that focuses solely on the development of specific diagnostic techniques without acknowledging the broader conceptual shifts in oral medicine would be professionally unacceptable. This fails to recognize that the specialty's evolution was not merely technological, but also conceptual, involving the integration of medical and dental knowledge. Another incorrect approach that prioritizes the contributions of general dentists who happen to treat oral lesions over the dedicated efforts of those who established oral medicine as a formal discipline would be ethically flawed. This diminishes the significance of specialized training and the deliberate pursuit of expertise. Furthermore, An approach that overlooks the role of academic institutions and professional organizations in formalizing oral medicine would be a significant oversight, as these entities were instrumental in its establishment and continued growth. Professional decision-making in similar situations should involve a critical evaluation of historical narratives, seeking out primary sources and scholarly analyses that detail the emergence of oral medicine. This requires distinguishing between anecdotal accounts and evidence-based historical accounts. Professionals should actively engage with the history of their specialty to inform their current practice and to contribute to its future. This involves understanding the why behind current standards and practices, fostering a deeper appreciation for the journey of oral medicine. Question 20. Compliance review shows a patient presenting with a non-healing oral ulceration that, upon biopsy, reveals features suggestive of a systemic autoimmune process. The oral medicine specialist has confirmed the oral findings, but recognizes the need for further medical evaluation. Which of the following represents the most appropriate and ethically sound course of action within the American Board of Oral Medicine's purview? Option A. Advise the patient that the oral lesion is benign and unrelated to any systemic issues, recommending only local symptomatic management. Option B. Provide a definitive medical diagnosis and initiate a treatment plan for the suspected autoimmune condition, as the oral findings are highly indicative. Option C. Refer the patient to an appropriate medical specialist for further diagnosis and management of the suspected systemic condition, providing a detailed summary of oral findings and biopsy results. Option D. Manage the oral ulceration with topical medications and await further developments, without immediate medical referral, as the systemic implications are not yet confirmed. The correct answer is C. Refer the patient to an appropriate medical specialist for further diagnosis and management of the suspected systemic condition, providing a detailed summary of oral findings and biopsy results. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the oral medicine specialist to navigate the intersection of their specialized dental knowledge with broader healthcare system needs. The challenge lies in accurately assessing the patient's systemic health implications stemming from oral findings and ensuring appropriate referral and communication with non-dental healthcare providers. This demands a comprehensive understanding of oral medicine's role beyond the oral cavity and adherence to professional standards for interdisciplinary care. Correct approach analysis. The correct approach exemplifies best professional practice by recognizing the systemic implications of oral disease and prioritizing patient well-being through collaborative care. This aligns with the American Board of Oral Medicine's emphasis on the integration of oral health into overall health. Specifically, it demonstrates adherence to ethical principles of patient advocacy and professional responsibility by facilitating a seamless transition of care to the appropriate medical specialist. This proactive referral and comprehensive communication are crucial for effective management of potentially serious underlying conditions, reflecting the expanded scope of oral medicine in modern healthcare. Incorrect approaches analysis. An approach that focuses solely on managing the oral lesion without considering potential systemic links fails to acknowledge the diagnostic and consultative role of oral medicine in identifying systemic disease manifestations. This represents a failure to uphold the comprehensive scope of oral medicine practice and potentially delays critical medical diagnosis and treatment, violating the ethical duty to act in the patient's best interest. An approach that involves providing a definitive medical diagnosis and treatment plan without appropriate medical consultation is beyond the scope of dental practice and constitutes a significant ethical and regulatory violation. This could lead to misdiagnosis, inappropriate treatment, and harm to the patient, undermining the collaborative nature of healthcare and the established boundaries of professional expertise. An approach that dismisses the oral findings as minor and unrelated to systemic health, without thorough investigation or consultation, demonstrates a lack of due diligence and a failure to recognize the potential for oral manifestations of systemic disease. This negligence can have serious consequences for patient health by overlooking critical diagnostic clues. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough clinical assessment, including a comprehensive history and physical examination. This should be followed by a differential diagnosis that considers both oral and potential systemic etiologies. Crucially, the framework must include a robust process for interdisciplinary communication and referral, recognizing the limitations of one's own specialty and the importance of collaborating with other healthcare professionals to ensure optimal patient outcomes. This involves understanding when to consult, how to refer effectively, and how to document these interactions meticulously.